Good morning, sir.
Very good morning.
Sir, may I have your good name, sir?
My name is Dr. Jaydip, chest physician.
Sir, sir, actually, as we know that tomorrow is World Asthma Day, so would you like to have some your views for our viewers, sir?
Asthma, as such, a very common, very heterogeneous, complex disease, but this is amenable to treatment if you continue treatment under guidance of a physician. Nothing to worry. Physician will guide you how to keep this disease under control. In few cases, it may be beyond control, but mostly in 80 to 90% cases, it remains controlled with minimum medication under guidance of a physician.
Sir, what is severe asthma, sir?
Severe asthma.
Severe.
Severe asthma is such an entity which remains uncontrolled despite highest dose of inhalational therapy with inhalational corticosteroid and long-acting bronchial agonist along with other medications along with modifiable risk factor management, comorbidity management and lifestyle management, non-pharmacological treatment management along with highest dose of drug therapy which asthma remains uncontrolled in spite of every effort, that is now categorized as severe asthma, which needs precision therapy in the form of biologicals.
Sir, how many types of asthma are there? Is there are different types of, or only asthma is of single kind, sir?
There are different types of asthma, and the term phenotype has coined for that. But for general people's purpose, it is better to be described for their purpose only. Allergic atopic asthma is one kind, which is very common since early childhood. Another is eosinophilic asthma, which is rather very common, and another type is overlap of this eosinophilic and allergic asthma pattern, and third pattern is non-eosinophilic, non-allergic but severe asthma. So for general people's knowledge, there are three such kinds of asthma: allergic or atopic asthma, eosinophilic asthma, non-allergic, non-eosinophilic asthma.
Is there any specific kind of investigation for detecting asthma, sir?
There are different kind of investigations. First, a patient has to be symptomatic with complaint of cough, chest tightness, and wheezy breathing along with shortness of breath, which varies over time, even in a day or in a week, in the morning, in the evening, for variable expiratory airflow obstruction in a day. There may be so many triggers, but first patient has to be symptomatic with breathlessness, cough, chest tightness. Then they will attend one physician's clinic or pulmonologist clinic. They will do a battery of tests, which includes a normal blood test, which sees the eosinophil count, and then they advise one chest X-ray, which is not very much required, but to exclude other diseases of shortness of breath. You need one spirometry, which shows post bronchodilator reversibility, whether it is significant or not, with short acting bronchodilators. And thirdly, there is one test called FeNO, which indicates eosinophilic airway inflammation. So with all these, we do phenotypic assessment of severe asthma, then we proceed for severe asthma treatment. And if the symptom remains controlled with minimum medications, then we call it well controlled asthma. If it does not remain controlled along with adequate medicines and lifestyle measures, modifiable risk factor management, comorbidity management, and high dose of ICS and LAVA, and additional drugs like LAMA, Montelukast and all, then we categorize it as severe asthma. So these are the common tests which has been done for phenotyping of asthma and to diagnose asthma.
Thank you, sir. Thank you so much for your important time, sir. Thank you.
Welcome.